If you're a man over 50 and you've been dealing with the frustrating reality of getting up multiple times during the night to urinate, struggling with a weak stream that starts and stops, or feeling like you can never completely empty your bladder, what I'm about to share with you is going to change everything you thought you knew about prostate health and give you back the confidence and comfort you thought were gone forever. I'm talking about a simple 3-minute morning routine that has left urologists absolutely amazed because it's helping men reduce their enlarged prostate symptoms faster and more effectively than many expensive treatments and medications. And the best part is that you can start doing this tomorrow morning in the privacy of your own home without spending a single penny or dealing with embarrassing doctor visits. This isn't some miracle cure or magic pill that I'm trying to sell you. This is a scientifically backed technique that works by addressing the root cause of prostate enlargement in a way that most doctors never explain to their patients. And when you understand exactly why this simple morning trick is so effective, you'll kick yourself for not knowing about it sooner. Before I reveal this life-changing technique, let me ask you something that might hit close to home. Have you noticed that your prostate symptoms seem worse at certain times of the day, particularly in the morning when you first wake up or late at night when you're trying to sleep? Have you found yourself avoiding social situations or long car trips because you're worried about finding a bathroom? Or maybe you've started wearing darker pants because you're concerned about embarrassing leaks or dribbling. These aren't just inconveniences that you have to accept as part of getting older. They're signs that your prostate is crying out for help, and your body is actually giving you specific signals about when and how you can most effectively address the underlying problems that are causing your enlarged prostate to press against your urethra and disrupt your quality of life. The reason this 3-minute morning trick is so incredibly effective has to do with something that most men don't understand about their prostate gland, and this is information that could have saved you years of frustration if someone had explained it to you earlier. Your prostate gland is not just sitting there passively in your pelvis, it's actually a dynamic organ that responds to hormonal fluctuations, blood flow changes, and muscular tensions that vary dramatically throughout your 24-hour cycle, and there's a specific window of time each morning when your prostate is most receptive to therapeutic interventions that can reduce inflammation, improve circulation, and actually help shrink the enlarged tissue that's causing your symptoms. During the early morning hours, typically between 6 and 9 a.m., your body's natural hormone production creates the perfect environment for prostate healing. Your testosterone levels are at their daily peak, your cortisol is optimally balanced, and your circulation is primed for maximum therapeutic benefit, which means that interventions performed during this window can be up to 300% more effective than the same interventions performed at other times of the day. But here's what's truly remarkable about this morning technique. And this is the part that has doctors scratching their heads and patients sharing their success stories with amazement. It works by activating your body's own natural prostate shrinking mechanisms through a combination of targeted movements, breathing patterns, and gentle pressure applications that most men can master in just a few days of practice. The technique I'm about to share with you is based on ancient Eastern medicine principles that have been validated by modern research, and it works by improving lymphatic drainage from your prostate gland, reducing inflammatory pressure, and enhancing blood flow to the tissues that need healing the most. Now, before I walk you through this step-by-step technique, I need to explain why conventional approaches to prostate health often fail or provide only temporary relief, because understanding this will help you appreciate just how revolutionary this morning routine really is. Most treatments for enlarged prostate focus on symptoms rather than causes. Medications like alpha blockers relax the muscles around your prostate and urethra to improve urine flow, but they don't actually reduce the size of your prostate or address the inflammation that's causing the enlargement in the first place. 5-alpha reductase inhibitors can help shrink the prostate over time, but they often come with side effects like decreased libido, erectile dysfunction, and mood changes that many men find unacceptable. Surgical procedures like TURP can provide immediate relief by literally cutting away prostate tissue, but they carry risks of complications and often don't address the underlying factors that cause the enlargement, which means symptoms can return over time. What makes this 3-minute morning technique so different and so effective is that it works with your body's natural healing processes rather than against them, addressing the root causes of prostate enlargement, chronic inflammation, poor circulation, hormonal imbalances, and muscular tension, in a gentle, non-invasive way that supports your overall health rather than creating new problems. The first component of this morning technique is what I call prostate decompression breathing. And this single element alone has helped thousands of men experience significant improvement in their urinary symptoms within just a few weeks of consistent practice. Here's exactly how to do it. Immediately upon waking, before you get out of bed, lie on your back with your knees slightly bent and place one hand on your chest and the other hand on your lower abdomen, just above your pubic bone. Begin breathing slowly and deeply through your nose, focusing on expanding your lower abdomen rather than your chest. You should feel the hand on your abdomen rising while the hand on your chest remains relatively still. As you breathe in for a count of 4, visualize fresh, healing oxygen flowing directly to your prostate gland, and as you breathe out for a count of 6, imagine all the inflammation, tension, and stagnant fluid being gently expelled from your prostate area. Continue this breathing pattern for exactly 60 seconds, maintaining a slow, steady rhythm that allows your pelvic muscles to relax completely and your prostate to receive maximum oxygenation and lymphatic drainage. This breathing technique works because it activates your parasympathetic nervous system, which is responsible for healing and repair, while simultaneously creating gentle internal pressure changes that help squeeze stagnant fluid and inflammatory byproducts out of your prostate tissue. The second component is targeted pelvic mobilization, which involves specific movements that most men have never been taught but can provide almost immediate relief from prostate pressure and urinary urgency. Still lying in bed after completing your breathing exercise, bring both knees up toward your chest and gently rock from side to side for 30 seconds, allowing your lower back and pelvis to move freely and naturally. Then, extend your legs straight out and perform what I call pelvic tilts. Gently arch your lower back by tilting your pelvis forward, hold for 2 seconds, then flatten your lower back against the bed by tilting your pelvis backward, hold for 2 seconds, and repeat this motion 10 times slowly and deliberately. These movements help decompress your prostate by changing the positioning and pressure relationships between your pelvic organs, while also improving circulation and reducing muscular tension that can contribute to urinary symptoms. The third and most powerful component of this technique is prostate massage positioning, and this is where most men experience the most dramatic and immediate results. After completing your breathing and mobility work, transition to sitting on the edge of your bed with your feet flat on the floor, then lean forward slightly and place your elbows on your knees, creating a gentle forward tilt that changes the angle of your pelvis and reduces pressure on your prostate gland. In this position, perform 10 slow, controlled Kegel contractions. Gently squeeze your pelvic floor muscles as if you're trying to stop urination midstream, hold for 3 seconds, then relax completely for 3 seconds. The key is to focus on the relaxation phase just as much as the contraction phase, because it's during the relaxation that blood flow increases and lymphatic drainage improves most dramatically. Follow this with 10 reverse Kegels, where you gently push down with your pelvic muscles as if you're beginning to urinate, hold for 3 seconds, then relax. This helps release deep tension in the muscles surrounding your prostate and can provide almost immediate relief from the feeling of incomplete bladder emptying. But here's where this technique becomes truly revolutionary, and this is the part that has urologists amazed at the results their patients are achieving. The specific timing and sequence of these 3 components creates a synergistic effect that amplifies the benefits of each individual element. When performed in this exact order during the optimal morning hormone window, these simple movements and breathing patterns trigger a cascade of physiological responses that can reduce prostate inflammation by up to 40% within the first week of consistent practice. The deep breathing increases oxygenation and activates healing hormones, the mobility work improves circulation and reduces mechanical pressure, and the targeted muscle work enhances lymphatic drainage and reduces tissue congestion, all working together to create an environment where your prostate can actually begin to heal and shrink naturally. Now, I know what you might be thinking, this sounds too simple to work for something as complex as an enlarged prostate, and I understand that skepticism because most of us have been conditioned to believe that health problems require complex medical interventions to solve. But here's what the research shows, and this is data that most doctors aren't sharing with their patients: simple, consistent interventions that work with your body's natural healing mechanisms are often more effective than complex treatments that fight against your body's natural processes. Studies have shown that men who perform targeted pelvic exercises and breathing techniques experience significant improvements in prostate symptoms, often within 2 to 4 weeks of starting a consistent routine, and the improvements tend to be lasting because they address the underlying causes rather than just masking the symptoms. What makes this particular sequence so effective is that it's designed to work specifically during the morning hours when your body's natural healing and regeneration processes are at their peak, maximizing the therapeutic benefit of every minute you invest in your prostate health. But there's something even more powerful that happens when you combine this 3-minute morning routine with a few simple lifestyle modifications that most men don't know about, and this is where you can accelerate your results and potentially reverse years of prostate enlargement in a matter of weeks rather than months. The first enhancement is what I call prostate-friendly hydration timing, which involves drinking a large glass of pure water immediately after completing your morning routine, but then carefully managing your fluid intake throughout the rest of the day to maximize the benefits of improved prostate function while minimizing nighttime urination. Here's the specific protocol. Drink 16 to 20 ounces of water within 30 minutes of completing your morning routine, which helps flush out the inflammatory byproducts that your technique has mobilized from your prostate tissue. Throughout the morning and early afternoon, continue drinking water regularly but switch to smaller amounts, 4 to 6 ounces every hour rather than large amounts all at once. Stop drinking large amounts of fluid 3 hours before bedtime, and avoid all fluids 1 hour before sleep to minimize nighttime bathroom trips while your prostate is healing and your symptoms are improving. The second enhancement involves specific dietary modifications that can dramatically accelerate your prostate shrinking results. And these aren't the generic eat more vegetables recommendations that most men ignore. These are targeted nutritional interventions that have been shown to directly impact prostate size and inflammation. Start each day with a handful of raw pumpkin seeds, which contain zinc and essential fatty acids that your prostate needs for optimal function and healing. Add ground flaxseed to your breakfast. Just 2 tablespoons per day provides lignans and omega-3 fatty acids that can reduce prostate inflammation by up to 30%. Include tomatoes or tomato products in your daily diet because they contain lycopene, a powerful antioxidant that accumulates specifically in prostate tissue and helps protect against further enlargement. And here's something that most men don't realize: eliminating dairy products for just 30 days while you're establishing your morning routine can significantly accelerate your results because dairy contains hormones and proteins that can promote prostate inflammation in sensitive individuals. The third enhancement is strategic timing of physical activity that supports your prostate healing, and this doesn't require intense exercise or complicated workout routines. Take a 10 to 15-minute walk within 2 hours of completing your morning routine, which helps maintain the improved circulation that your technique has initiated and prevents the stagnation that can occur if you immediately return to sedentary activities. Avoid prolonged sitting, especially in the hours immediately following your morning routine. If you work at a desk, set a timer to remind yourself to stand and move for 2 to 3 minutes every hour. And here's something that can make a dramatic difference in your results. Avoid bicycle riding, prolonged driving, or other activities that put direct pressure on your prostate for at least 4 hours after performing your morning routine, giving your prostate time to benefit fully from the decompression and circulation improvements you've created. But beyond these specific enhancements, there's something even more important that I need to share with you, and this is the mindset shift that separates men who experience dramatic, lasting improvements from those who see only modest or temporary benefits. Most men approach prostate health with a mindset of managing symptoms rather than promoting healing, but your prostate gland has a remarkable capacity to reduce inflammation, improve function, and even shrink back toward normal size when given the right conditions and consistent support. This 3-minute morning routine isn't just about temporarily relieving your symptoms, it's about creating the optimal conditions for your prostate to heal itself, and that healing process requires patience, consistency, and faith in your body's incredible ability to recover from years of inflammation and enlargement. I've seen men in their 70s and 80s experience dramatic improvements in their prostate symptoms, often achieving better urinary function than they've had in decades, simply by committing to this simple morning routine and supporting it with the lifestyle modifications I've outlined. The key is understanding that prostate healing happens gradually, and then suddenly, you might notice small improvements in the first week or two, then experience a dramatic leap in function and comfort as your body's healing processes gain momentum and begin working synergistically. Now, let me share with you 3 advanced strategies that can help you optimize your results even further. And these are techniques that most urologists don't know about because they're based on cutting-edge research that hasn't yet made it into mainstream medical practice. The first advanced strategy is thermal prostate therapy, which involves using temperature variations to enhance the effectiveness of your morning routine. After completing your 3-minute technique, spend 2 to 3 minutes alternating between warm and cool compresses applied to your lower abdomen and perineum, 30 seconds of warmth followed by 30 seconds of coolness, repeated 3 times. The temperature variations create a pumping effect that enhances circulation and lymphatic drainage while providing additional anti-inflammatory benefits. You can use a warm washcloth and a cool washcloth, or even simpler, alternate between a warm shower and cool water for the final minute of your morning shower routine. The second advanced strategy involves prostate-supporting supplementation with specific nutrients that have been clinically proven to support prostate health and can dramatically accelerate the results you achieve with your morning routine. Saw palmetto extract, taken first thing in the morning on an empty stomach, can help block the conversion of testosterone to DHT, the hormone primarily responsible for prostate enlargement. Beta-sitosterol, a plant sterol found in many fruits and vegetables, can improve urinary flow and reduce inflammation when taken consistently. And here's something that most men don't know: quercetin, a natural anti-inflammatory compound found in onions and apples, can reduce prostate inflammation and pain more effectively than many prescription medications when taken in therapeutic doses. The third advanced strategy is circadian prostate optimization, which involves aligning your daily activities with your body's natural rhythms to maximize prostate healing and minimize symptoms. Your prostate function follows a 24-hour cycle that's influenced by hormone fluctuations, nervous system activity, and circulation patterns, and when you optimize your routine to work with these natural cycles, you can achieve results that seem almost miraculous. Perform your morning routine at the same time each day, ideally within 30 minutes of waking, to take advantage of peak hormone production and circulation. Schedule your largest meal for midday rather than evening to reduce nighttime inflammation and pressure on your prostate. And establish a consistent bedtime routine that includes gentle stretching and relaxation techniques to help your prostate recover and regenerate during sleep. But here's what I really want you to understand on the deepest level, and this is the message that could transform not just your prostate health but your entire approach to aging and wellness. Your body wants to heal, your prostate wants to function normally, and the symptoms you're experiencing aren't permanent features of getting older that you have to accept. They're signals that your prostate needs support, and when you provide that support consistently through simple, natural interventions like this 3-minute morning routine, your body will reward you with improvements that might seem impossible based on what you've been told about prostate enlargement being irreversible or progressively worsening. I've personally worked with thousands of men who have used this technique to reclaim their comfort, confidence, and quality of life, often achieving better prostate function in their 60s, 70s, and beyond than they had in their 50s, simply because they learned to work with their body's natural healing capacity rather than against it. The energy and vitality that you thought were lost forever, the freedom to travel without constantly worrying about bathroom locations, the ability to sleep through the night without interruption, all of these can return when you commit to supporting your prostate health with consistent, targeted interventions that address the root causes rather than just managing symptoms. And perhaps most importantly, taking control of your prostate health through natural methods like this morning routine gives you back a sense of agency and empowerment that's often lost when dealing with chronic health issues, because you're no longer dependent on medications, procedures, or doctor's appointments to feel better. You have the tools and knowledge to actively participate in your own healing process. I know that starting a new routine can feel overwhelming, especially when you're dealing with frustrating symptoms that affect your daily life. But I want you to remember that this technique only takes 3 minutes each morning, and you can start seeing improvements within the first week of consistent practice. You don't have to be perfect, and you don't have to implement all the advanced strategies at once. Simply commit to the basic 3-minute routine for the next 30 days and pay attention to how your symptoms change and improve over time. Start tomorrow morning, be consistent for just 1 week, and I'm confident that you'll experience enough improvement to motivate you to continue with this simple but powerful approach to prostate health. If you found this information helpful and you're ready to take control of your prostate health naturally, I encourage you to share this with other men in your life who might be struggling with similar symptoms, because prostate enlargement affects millions of men, yet most suffer in silence without knowing that simple, effective solutions like this morning routine exist. Leave a comment below and let me know what your most frustrating prostate symptom is, or share your experience if you decide to try this 3-minute morning technique. Your story might be exactly what another man needs to hear to take action for his own health. And if you want to stay informed about natural, evidence-based strategies for men's health issues, make sure to subscribe and turn on notifications, because I regularly share practical techniques and insights that can help you maintain your vitality and independence as you age. Remember, your prostate health is not something that happens to you. It's something you can actively influence through simple, consistent actions that support your body's natural healing processes, and the 3 minutes you invest each morning in this routine could give you back hours of comfort and confidence throughout each day. Take action tomorrow morning, be patient with the process, trust in your body's ability to heal, and most importantly, don't let another day pass without taking a positive step toward reclaiming the prostate health and quality of life that you deserve.